Thanks for joining me for another episode of the Longevity Blueprint podcast. Today I have Dr. Beth O'Hara, who is a functional naturopath specializing in complex chronic immune conditions related to Mast Cell Activation Syndrome and histamine intolerance. She's the founder and owner of Mast Cell 360, a functional naturopathy practice designed to look at all factors surrounding health conditions, genetic, epigenetic, biochemical, physiological, environmental, and emotional. She designed Mast Cell 360 to be the kind of practice she wished had existed when she was severely ill with Mast Cell Activation Syndrome, histamine intolerance, neural inflammation, Lyme, mold toxicity, fibromyalgia, and chronic fatigue. Her mission today is to be a guiding light for others with Mast Cell Activation Syndrome, histamine intolerance, and these related conditions in their healing journeys. Through her Mast Cell 360 root cause process, she discovers the unique root factors affecting each of her clients' health issues, building a personalized, effective roadmap for healing. She holds a doctorate in functional naturopathy, a master's degree in marriage and family therapy, and a bachelor's degree in physiological psychology. She's a certified functional genomic She is certified in functional genomic analysis and is a research advisor for the Nutrigenetic Research Institute. She presents at functional medicine conferences on Mast Cell Activation Syndrome and histamine intolerance, as well as the use of genetics and biochemistry in addressing chronic health conditions. Wow. So welcome, Beth, to the show.
Thank you so much, Stephanie. It's great to be here, and I'm excited to dive into this because I often find that talking about mast cell activation is a game changer for a lot of people.
It really is, and I found that has helped many of my patients, and I should call you Dr. O'Hara, so I apologize for that.
Please call me Beth.
So your journey started as Beth before you became Dr. O'Hara, actually. You had to walk with a cane by the time you were 28, and you were bedridden for quite a while. So can you share with us the story, what you've been through, and how that got you into, we'll just say, looking much younger as compared to looking older?
Well, it was quite the journey, and parts of it were a bit of a nightmare. So when I was 7, my family moved to an old farmhouse out in the country. And I was really excited about this, and I was really into Laura Ingalls Wilder at the time. So that's what I thought, we were doing. And what I didn't know at the time, I need to pause and
You're fine. Go for it. Yeah, we can edit any of this out. I'm new at this, and like your bio, when I messed up, I'll be editing that.
Still have mast cell activation. I'm having drainage. I'll just start back from the beginning because it was kind of froggy. So my story was quite an intense journey, and it really started when I was 7. My family moved out to the country and into this old farmhouse. And I thought I was really into reading Laura Ingalls Wilder, and I thought that, this would be that kind of adventure. And parts of it were really fun and great. But what I didn't know at the time, none of us knew that house was full of toxic mold. I also didn't know anything about Lyme disease back then. So I played outside all the time, had numerous tick bites. I'm pretty confident I've had Lyme, Bartonella, and Babesia. And my health issues just continued to accelerate as I was a child. My mother took me from doctor to doctor. Nobody could figure out what was going on other than somebody did figure out I should be put on a lot of antihistamines, which helped quite a bit. I would itch, I'd have hives, I'd be scratching my eyes all the time, sneezing, I had asthma. I was kicked in the head by a horse when I was 9 and had a brain injury. And then that set off a whole series of things. And this journey just kept continuing like that until, as you mentioned, I just kept getting more and more ill. And when I was in college, my dream was to go to medical school. And I had a full scholarship, which is kind of rare to get. And the most probably devastating thing of my life, one of the most devastating, was I had to turn it down because I was so ill. And I knew that if I did make it through the 4 years of medical school, there was no way I was going to make an 80-hour-a-week residency. So I took this whole other journey of being a chronically ill patient and eventually got to where I just couldn't hardly get out of bed. At age 28, I started having to use a cane to be able to walk. And it was weird. It would be during the winter, and then it would get better in the summer. It took until I was about 35 years old to realize, and I'm in my 40s now, But it took until then to know that I had mast cell activation syndrome, and then even longer to know I had mold toxicity. And so there were about 15 years of being just severely ill, unable to work much, and sometimes being really bedridden and not able to work at all. But, and I just went to so many practitioners. I probably
I
saw,
bet.
I stopped counting at 50, and I stopped counting at when I had spent over $150,000. I know it's way more than that now. And nobody could figure this out, but I finally hit on mast cell activation syndrome. Yasmina Kellenston was somebody I was following back then. Figured out I had histamine intolerance, I had oxalate issues, I had mast cell, and then started putting the pieces together and how to address this because nobody had this figured out at the time. And it's taken quite a lot to put that together. The last piece was the mold toxicity, and realizing that I'd had about 20 years of mold toxicity exposure through that old farmhouse and then different workplaces and different places I had lived, especially in college, living in less expensive housing and what I could afford at the time.
Wow, you've been through a lot. I have to ask, were any of your family members sick also?
There've been some different health issues. No one was as ill as I was. And I think part of that, a big part of that are the genetic differences.
Yep.
And so my sister is a half sister. And so we had different fathers. And I think that was a big part of the genetic differences.
Sure.
Nobody was as sick as I was at all.
Took you a long time, but thankfully you found some answers, and now you're shedding hope, light on others who are experiencing similar struggles. So let's break down what mast cell activation syndrome is, because I don't think a lot of patients and practitioners really know what this is, but also differentiate this from histamine intolerance or discuss the overlaps. Can you talk more about that and symptoms one may be experiencing if they have these conditions?
Yes, for sure. I'd like to start with histamine intolerance because it's a little simpler.
Yeah.
So histamine intolerance, most people have heard of histamine, and if they have allergy symptoms, they might grab an antihistamine. So histamine intolerance is where the body has trouble breaking down histamine, the histamine levels that are there. And it can either be because there's too much histamine inflow from eating a lot of high histamine foods or the body overproducing histamine, or that the histamine degrading enzymes are not functioning properly. That can happen for genetic reasons or nutrient depletion, medications, things like this. So that histamine builds, and it can cause a number of different symptoms because of all the roles histamine has in the body. So histamine has a role in digestion and activating stomach acid. It works as a neurotransmitter, helps regulate sleep-wake cycles, and it's really involved in the inflammatory response. So we get a lot of overlapping symptoms with histamine intolerance. And mast cell activation, the classic of both are going to be things like itching, sometimes rashes, hives, loose stools is very common, but sometimes people will have constipation, can have heart palpitations, can have mood swings, depression, insomnia, anxiety, depending on which systems are being affected. Mast cell activation syndrome is related, but much more complex in that what I know you know, but some of our listeners may not know that those mast cells are the frontline defenders of the immune system. And so they're out there sensing for pathogens, for toxins, and they have over 1,000 receptors on the outside. So they can respond to so many different things, even things like electromagnetic radiation, they can respond to, mold toxins, pathogens other than mold, all of these different things. And the mast cells have over 1,000 different mediators that they can release. Histamine is just one. So we have cytokines, which is really popular word that all of a sudden most of the world knows now. But people didn't know about cytokines before we got into everything that's happening in the world currently. Interleukins, prostaglandins, there's tons of different inflammatory mediators. And the mast cell's job is when there is a pathogen like a bacteria or a virus or a mold spore, or if there's toxins, if there's injury, their job is to go in, create inflammation to surround that invader or that toxin, or even part of the recovery from injury, a lot of people don't know about, is that you have to have some inflammation there. So most people's experience of the mast cells are when they've had like a cut or a splinter or a piece of glass that got stuck in their skin and they didn't get it out fast enough, and then or I didn't clean it out, and you'll get that redness, puffiness, sometimes you'll get itchy. The mast cells are a big part of that response, creating that. What happens in mast cell activation syndrome is that there's been too much constant onslaught on those mast cells. There are some genetic markers that can contribute. So there's genetic based, and most mast cell activation syndrome is secondary. It's not genetic based, but there are a lot of markers that can be involved. So I think of it like if you have guards of a castle gate, and those guards are doing their job. They should be able to, be on duty for 8 or 12 hours and then go rest. But in mast cell activation syndrome, and what's happening in our world now, is we just have this constant parade of toxins coming at us, electromagnetic fields. Mold toxicity has become much bigger issue than it was 50 years ago. So you have all of these different things coming at the mast cells. We have more issues with infections. So the mast cells aren't getting a break. And when they have to be on guard all the time, 24/7, it's like the programming gets dysregulated. And so they become hyper responsive and inappropriately responsive. So instead of just targeting those toxins or those pathogens or that injury, they can start targeting across the board. So I say, instead of just shooting at the enemies, now they're also shooting at the butterflies. So it's not the mast cells that are at fault there. They're doing their job to protect us. They're doing the job to keep us alive and as healthy as possible. Because if we just wipe them out, then those toxins and pathogens have free reign in the body. And that's not a good situation. And I think that's why I got so ill, because I was on so many antihistamines and mast cell stabilizing medications. And the mold and the Lyme, the Bartonella, the Babesia had free reign in my body. So I felt so much better for about 3 or 4 years. And then I really started going downhill. And I've seen that over and over in my practice as well.
Very interesting. So many things I want to comment on. I want to go back to symptoms for a moment. So when I think histamine, I think redness, like you mentioned, right? So that's actually, we have a great response. Our body is designed, right? When you have a splinter, you have that redness, that's a good thing. So when I think histamine intolerance, I also think flushing, like a lot of patients who get very red. I've had some patients whose whole body is just red. They're so flushed. And then I think mast cell activation syndrome, right? When the patient's that red. Also headaches. And then I see a lot of vertigo and just kind of unexplained dizziness. Would you agree with those too?
Absolutely. Migraines, there's so many symptoms, it would be hard to even go through them all, because part of the criteria of whether it's mast cell activation syndrome is are these symptoms affecting 2 or more systems? I have people in my practice. So I have a woman I'll call Jane, and she has anxiety, insomnia, and digestive issues like acid reflux and diarrhea. So then I have Brian, I'll call him Brian. He doesn't have those symptoms. He has heart palpitations, he has rashes, he has hives, trouble tolerating supplements. So we can get very different presentations in mast cell activation syndrome. And I think that's why it's taken so long for people to realize what's going on. And it's also been thought to be very rare for a long time. But the truth is that the studies are showing between 9 to up to 17% of the general population are dealing with mast cell activation syndrome, which is huge. It's like 1 in 10, or maybe even 1 in 8, 1 in 7. And in the chronically ill population, I think at the very lowest, it's 50% or more, because anywhere you have inflammation, you have a mast cell involvement.
Sure. Maybe I'll stay on that topic for a moment. So talking about the different criteria patients have to meet full-blown diagnosis. When I first started learning about this years ago, I would send patients to a university that was close to us. So I thought, oh, surely they'll know how to diagnose this. Surely they'll be able to help this patient. And 9 times out of 10, the testing that they would have run, the patient would not fail. And so the patient would come back to me and I said, I really, really think you have the syndrome. But at that point, I didn't know what to do for them. Yet they're failing the conventional criteria. And so then the patient's left back at square one. So can you talk about why many times testing is negative on these patients?
Yeah, I'm really glad you brought it up, because it's a huge problem. And what people need to know is the diagnostic criteria wasn't even official until 2016. So this is considered a newly understood condition. And part of that diagnostic criteria is what we talked about, symptoms in more than two systems.
Yep.
Somebody has to respond to antihistamines or mast cell stabilizing medications, but they often have fillers or other ingredients that are triggers. So a lot of people react to them and can't take them. And then I'm seeing the exact same statistic you are. Only 10% of people are having positive lab work that is part of that diagnostic criteria of whether you have mast cell activation. And the reason is because these mediators are up and down in the blood or even in the urine very quickly.
Sure.
So it might be elevated for 15 minutes and then back down again. And I've heard of practitioners who are doing testing in office and they need to get the diagnosis for insurance coverage, having their patients in the office for 8 hours, having them do things to provoke. A flare,
yeah.
and which is not a great idea for people who are really sick, but that's what they have to do just to get the insurance coverage. And then they're testing every hour on the hour to try to get a positive marker. That tells me something's wrong with that criteria. It needs some more work.
Totally agreed. Totally agreed. I want to go back to something else that you mentioned. So you mentioned patients can have histamine intolerance for a couple different reasons. One, for consuming foods high in histamine, and I'm thinking about the lunch I had today. It's very high in histamine. It was a healthy salad, but everything I put on it, avocados, and everything I put on it was very high histamine. But they also could have a deficiency in the enzyme needed to break down histamine. And I believe in my past, I had a much stronger histamine intolerance than I do now when I was eating a lot of gluten, because my understanding is that gluten will essentially rob your body of Diamine oxidase, as will a condition called SIBO, which I've had. So my body, I didn't have the Diamine oxidase I needed to break down the histamine. So let's talk about those two separate things. So first, can we go through foods that are very high in histamine that these patients should be minimizing or avoiding?
Yes. And I want to preface it by saying in my practice, I see maybe about, now my practice is mast cell activation. So I'm not seeing all the people that just have histamine intolerance.
Sure.
But I do see about 5% of people that only have histamine intolerance. And maybe 10% of people in my practice only have mast cell activation. They don't have histamine intolerance. The majority of people in the middle have both.
Okay.
And part of this is because so diamine oxidase that degrades histamine in the gut, anytime we have gut inflammation, it's going to be affected. And then there are a number of medications and even supplements like curcumin that decrease diamine oxidase. A lot of antibiotics decrease it, a number of antidepressants. There's a huge class of categories that affect that. Then we have the other enzyme, the HNMT, and that enzyme, histamine N-methyltransferase, is dependent on methylation, and it acts more systemically. Then we have these minor ones.
And there are genetic variants for both of those enzymes that you just mentioned.
Exactly.
That we can check patients for.
Yeah. And so those high histamine foods, especially part of what's going on right now, is that we have these kind of food fads, healthy food fads. So some of the big ones are spinach. And I have people come in sometimes that have been put on by a well-meaning nutritionist who wanted to boost iron or whatever, and had people do spinach smoothies. And spinach is one of the highest histamine foods. And some of the other highest histamine foods are going to be things like pineapple and strawberries that are quite healthy. Ground meats are going to be higher histamine. Fish is higher histamine. And then we have other things like kombucha, which is such a popular thing right now, but it's high histamine, as well as fermented foods are high histamine. Most probiotics on the market have 2 histamine raising strains in them. And so that can be a reason why some people don't tolerate probiotics. But these are things that are become very popular culturally. And it's not that they're bad foods. And it's not that those probiotics are not good probiotics. It's just if you have these conditions, then these aren't going to be the best. And you want to choose lower histamine berries like blueberries and blackberries. And you can do, instead of ferments, I'm working on a low histamine ferment. I haven't gotten there yet, but I'm working on that. And have been talking with some people who are really into that world and have some information. So I'm hoping to work on that this year. But we have to watch those foods, and that made a big difference for me, and does for a lot of people in my practice, not everybody, but just to take that histamine load down. And when people have mast cell activation syndrome, we have to remember that the mast cells have histamine receptors on the outside. So even if somebody doesn't have histamine intolerance, if they're eating a lot of high histamine foods, those can still trigger those mast cells.
Wonderful. So what about the enzyme again? So obviously we need to work on reducing gut inflammation, right? So in my case, that was removing the gluten, treating the SIBO, removing that inflammation so that my body could make more diamine oxidase. But in your practice, do you also supplement that? Do you recommend patients take that enzyme?
I do, and we have to be careful, because the old formula, which is still out there, the old diamine oxidase formulas, had talc and shellac and some things that often aren't as well tolerated. So this was a diamine oxidase capsule that had little pellets in it. So people would know for sure if that's the formula they have. They're little yellow pellets. There's a new formula out now that is much more suited for people with mast cell activation. I do use it a good bit, but I'm still having people react to it. And it's because the ascorbyl palmitate, I believe it's because this ascorbyl palmitate that's in it is, that's a form of vitamin C, but it's from a fermentation process and also from corn. And so what we're in the process of developing, and should be out pretty soon, is a very specific diamine oxidase for people with mast cell activation. And histamine intolerance that are super sensitive. So this is going to be a new one on the market that's coming out soon.
So then that enzyme, when patients consume foods still that have histamine, I mean, a lot of foods have histamine.
Yeah.
Even if you're consuming the lower histamine foods, the enzyme will help those patients break that histamine down so they're not as negatively impacted, correct?
Exactly. And just the act of eating produces histamine in the gut. So that's something that we have to keep in mind as well. So the best thing to do with the diamine oxidase is to take it about 10 to 15 minutes before eating. So it gets in the gut ahead of the food. The capsule can get dissolved. It won't, though, if somebody wants to go, all out and have champagne and wine and lobster and these kinds
olives
of things,
and pickles,
olives, then it's not going to degrade all of that histamine. So we still want to, if people have mast cell activation histamine intolerance, we still want to eat responsibly.
Of course.
But I'm finding it make a huge difference in people that are having trouble eating, reacting to a lot of foods.
Yeah.
And also every once in a while somebody does need a treat. So lobster and champagne is mine. So once a year I'll do that, maybe on my birthday. But usually I'll take about 6 to 8 capsules beforehand.
Wow.
To try to keep up with the load.
So you titrate your dose accordingly based on your histamine load, essentially, for that
exactly,
meal.
Yeah.
When I started practice 10 years ago and I started learning about food sensitivities, I thought, everybody has food sensitivities, which a lot of people do. However, when you have heart racing after a meal, maybe it's actually not the gluten, maybe it's the histamine in the meal. So I started kind of learning this is something we really need to be exploring in our patients, and it served them very well, thankfully.
Yeah.
So let's talk a little bit. Actually, I want to go back to another supplement. What are your thoughts on quercetin? Do you use many mast cell stabilizers, and what are your top favorites?
I do use a lot of supplements. It depends on the case. So quercetin is really well tolerated by about half of people that I see in my practice, and not by the other half. And the reason is because quercetin is a methyl compound. So that quercetin is going to contribute to methylation. It has to get broken down by an enzyme called COMT, which I know you're familiar with. Mm-hmm. So I find that when people are over methylated, and particularly when people have mold toxicity, their methylation, there's a lot of changes that happen. They can either be very under or very over methylated. So sometimes I can get a sense, not always, but sometimes looking in the genetics, checking the COMT, asking about the symptoms. If they have a lot of anxiety and insomnia, I won't usually use it. But if somebody doesn't, if they're more even keeled and they're sleeping okay, then we might give it a go. So that quercetin has some pros and cons depending on the person, but for the right person, it's fantastic, and people typically do really well with it. The trick on it is that it's absorbed better if it's taken with fats. And so sometimes even people will open the capsule into some kind of olive oil or whatever type of fat that they'll tolerate. But I mostly tell people to take it with a meal with some fats. There are a lot of other supplements that are very helpful. And one that I have people try quite a bit is perilla extract.
Never heard of it. Tell me more.
So perilla extract is high in luteolin and rosmarinic acids. Those are both very helpful for supporting mast cells. So I really like that. It's a little tricky to find.
Is that better tolerated in more individuals than quercetin then?
I do find it, yeah. Another one that is, well, some of the really important ones are things like vitamin A, vitamin D, vitamin E. With vitamin A, so many people have the BCM01 variants that converts the beta carotene to retinol. And so the form that I usually use, because that pathway may not be working fully, is vitamin A acetate, which is a natural form of vitamin A, instead of, there are other forms, I'm blanking on what the synthetic kind is.
Like the carotenoid, just the carotenoids?
No, not the carotenoids are very helpful.
Okay.
But most vitamin A supplements that aren't beta carotene are synthetic. And so I find that the
acetate,
that vitamin A acetate is usually tolerated a little bit better. And I'm going to actually get into a lot of this in a master class that I'm launching in August. And I'm going to step people through the top 8 supplements that I use and talk really about what these actions are and how people can determine whether that might be a good fit for them based on what kind of symptoms they have, what kind of background that they have in their health history.
I love that. That's so exciting because there are just these little snippets that, you know, you think everyone would benefit from quercetin, but clearly they don't. There are these little clinical pearls that only practitioners like you really know who have been treating patients for a long time. No.
Well, I really specialize in the most sensitive people who, most people, by the time they see me, they've seen at least 10 practitioners, if not more. So it depends on the type of practice. If it's more of a general practice and people aren't as severe, quercetin is probably a great go-to.
Sure.
But when you've got people that nothing's making sense and they're having paradoxical reactions, then it's usually not my first go-to.
Sure. Well, you mentioned that that mycotoxins and treating yourself for those was a big part of your healing journey. So that is one of the common root triggers that I find for mast cell activation syndrome. I want to dive into that a little bit, but do you want to list some other common triggers and then maybe we'll focus on mold for a little bit more?
Yeah, the mold toxicity is by far the largest root trigger that I see. It's about 80% of my practice. And I would have never guessed it until I started looking for it. And it's just amazing how huge it is. But any kind of chronic infection is going to be a mast cell trigger because of how the Th1 and Th2 parts of the immune system work, with the Th1 side, for people who are not aware, being the pathogen sensing and pathogen killing side, and the Th2 side is involved in long-term chronic inflammation. So whenever we've had infections that we can't resolve, then what happens is the Th2 side takes over, but the Th1 side comes down. So we have less ability to fight off pathogens and more inflammation. So I see that pattern quite a lot. And mold toxicity makes that even worse because of how much it dysregulates the immune system and dampens it. Some of the other triggers, so foods are a big one. I talk a lot about histamines. I also talk about oxalates and lectins. Lectins, actually the mast cells have a receptor that lectins and foods dock on. And lectins are things like our nightshades, like potatoes, tomatoes. So a lot of people have been told to avoid those because of arthritis. And that's part of why is the lectin component. Wheat is very high in lectin, and one of the reasons why people can have trouble tolerating wheat. A lot of grains, things like sunflower seeds, pumpkin, so on. So we have those foods, we have pathogens. Toxins are huge. So I run a chemical toxin panel on people, take a look at what we're seeing there. Hormone dysregulation, huge, and I know that's one of your primary areas there. And anytime we're estrogen dominant, even in menopause, that's a mast cell trigger. Estrogen increases histamine, and then histamine increases estrogen. So it just becomes a cycle. But cortisol and progesterone have really important mast cell stabilizing effects, and also DHEA. But when we have excess estrogen or not enough progesterone in relationship, or if there's too much testosterone, that's a trigger. So we have those. One of the biggest ones also that I see is stress and trauma. Mm-hmm. And I always list it last because when I list it first, people stop listening to me. So I save it for the end, but it's one of the biggest pieces. And I find in my practice that about 50% of the healing process is addressing the nervous system, the parasympathetic, the limbic system, calming that down. And because mast cells are so intricately entwined with the nervous system, it's so much so that I've done experiments where I've ruminated on something, and one of my biggest first symptoms will be my knuckles will swell. And I can tell how my mast cells are doing by how my knuckles look in my hands. And now if I start ruminating and get stressed, in about 2 or 3 minutes, my knuckles are swollen and red. And then I can switch into a breathing meditation practice, and in about 5 minutes, it's gone.
You have a good gauge. Yeah.
It's a good gauge. And this is what's happening for most people. So it's critical for them to learn to address stress and their thoughts and have some kind of practice where they're grounding and centering and relaxing every day.
Wonderful, which is the opposite of all the electromagnetic chaos that we're exposed to, that I do want to mention, because I find so many patients with mold toxicity who have Mast Cell Activation Syndrome have major electromagnetic hypersensitivity. So there's a big relationship, and I think they all drive each other, make each other worse. Would you agree, or do you want to expand on that?
Absolutely. So some of the things that really make people, there is a genetic variant, CAC1, I'm going to butcher this, CAC1NAC1, I think is the right way, is it? But there's actually calcium channel genetic variants that make people more electrosensitive. And the calcium channels are allowing calcium into the cell, and then it increases glutamate levels, which can cause anxiety, insomnia, inflammation. But mycotoxins also affect that channel significantly. So do metals. Since I had the braces, this is the other root cause I didn't talk about, is airway obstructions. And so a lot of people whose parents didn't have good nutrition and they didn't have good nutrition in childhood have narrow dental plates. And mine was quite narrow, and it's almost doubled in size with the braces. And it's been a huge shift, but the metal in my mouth makes me much more electrical sensitive. So my laptop is pushed away. I use a USB keyboard. I don't use Wi-Fi. I always use a hardwired connection.
And the EMFs, circling back around, allow more calcium to enter the cell, which cause more excitation. So yes, these are all interrelated, and there are things we need to focus on with these patients to get them better.
Exactly, yeah.
So let's go back to mold for a moment. So you discovered you had mold toxicity, and I've heard you on other podcasts share that you have been re-exposed on numerous occasions, unintentionally, of course. So what is your favorite way to test your patients for mold toxicity, and then how do we tackle that?
Well, the top ways that I use are urine testing. I use 2 panels simultaneously if we have the budget for it. I use Real Times and I use Great Plains. The reason for both is because the Great Plains method is great for some of the mold toxins, but misses some of them. And the Real Times method is great for some of the mold toxins, but they miss some. And it's a smaller panel. They don't have as many mold toxins on there. Those are the 2 that I found to be the most reliable. I've tried some different ones to see how it went, and also checked in with some other practitioners who are doing this, and that's what they're noticing. The urine testing, to be more accurate, is really helpful if there can be some gentle provocation with glutathione and some sweating, but most people with mast cell activation don't tolerate heat. I have a few that can do sauna or can do hot showers. But typically we have to use glutathione. Sometimes people can't do either. And so I'll run the urine panels to see, sometimes we'll catch it, sometimes not. If somebody's super sensitive and they can't do provocation and we have a high suspicion, we might do blood antibody testing.
Wonderful. So when we find that a patient has mold toxins inside them, then we have to remove them from the exposure, which many times is their residence, right? And or at least help them remediate, find the person that can help them remediate their home, and then put them on binders. And I was talking to Dr. O'Hara before we started this podcast today, discussing how she was recently on the Better Health Guy blogcast. And there was a very interesting handout that was listed in the show notes that I just started diving into regarding specific binders for specific mycotoxins, because I've just heard conflicting opinions on that for a long time, which maybe we can talk about more after the show too. But generally speaking, depending on who you listen to, some providers aggressively use a medication called cholestyramine, while other providers don't use that. They use more blends of activated charcoal and clay and pectin and zeolite, whatnot. So what are your favorite binders, or do you really feel strongly that approach has to be personalized also?
I believe it's got to be personalized for the majority of sensitive people and people with mast cell activation. If somebody has more mild mold toxicity and they don't have a lot of mast cell activation, which actually isn't common, because of how much mold toxins cause mast cell activation, then maybe we can use a generalized approach. If there's not the budget for the testing, then I'll use a generalized approach and see where we get.
Sure.
The testing is so helpful because, for example, the binders that Beths bind ochratoxin are completely different than the binders that Beths bind gliotoxin. And if I just do that ochratoxin binder list, I'm going to miss it. I've also found a lot of people with mast cell activation don't do well with cholestyramine.
Why is that, do you think? Because of the sweetener, or even if it's compounded?
I think partly because the regular kind usually has artificial sweeteners. Mm-hmm. And I think it's just too harsh. So the approach that I go with, and my motto in my practice for the kind of people I work with, is fast is going to be actually slow. But if we go slow, it's going to be faster in the long run. And that's because if we go too aggressively, we can set off a mast cell cascade where we start to trigger some mast cells in a localized area. They start to release their inflammatory mediators. They trigger the surrounding mast cells. And you can imagine how that can expand exponentially until somebody's in a several week or several month flare. But again, I'm seeing super, super sensitive people. So we always start with the gentlest binders first. So if it's called for, that might be charcoal and bentonite clay. And then things like zeolite or cholestyramine, if it was going to be used, or Welcall, sometimes better tolerated, then those would go on at the end of adding the binders in.
Sure. I was unaware that Saccharomyces boulardii, however we pronounce that, was a binder. So that also can be beneficial for select cases. I'm looking at this spreadsheet right now as we talk.
Yeah, we find it really most helpful for gliotoxins. And gliotoxins I see create a lot of nervous system effects, insomnia, anxiety, sometimes trembling, and things that look like Bell's palsy, and seizures I see associated. Now, some of the other mold toxins can cause that as well. I just see a connection there with that gliotoxin. So that actually came from Dr. Neil Nathan. He's the one that discovered the Saccharomyces boulardii.
Very interesting, very interesting. So it sounds like mold toxicity and mast cell activation syndrome are extremely related. So do you treat them concurrently? Or do you find that when you treat the mold, the mast cell activation syndrome reduces and then they don't need as aggressive a treatment?
We have a blog post that lays this out, like kind of these stages, so people can find them. So actually the first level for me is the limbic, the parasympathetic, and if needed, vagal nerve supports. Calm the system down. So a lot of times people aren't tolerating very many things when I see them. So we'll just calm that down, take that load off, and do that for a good 6 weeks. Then depending on how much they're tolerating, if they're tolerating more, we can bring some of these mast cell supporting supplements in at the beginning. Then we'll go in and do the binders, and we'll layer those on one at a time, slowly build them up. So we have a nice complement based on which mold toxins that they have. Then we'll do some phase 2 supports, detox supports. And what was really interesting in the research that we did around this, and so this research was done with Neil Nathan and Emily Givler. And we found that most practitioners were using glutathione for mold toxicity, but some mold toxins use glutathione to detox, but majority by far uses glucuronidation, which is a pathway a lot of people don't know about, and I didn't know about until I got volunteered to present at a conference on it. So that was pretty incredible to figure that out. So that will accelerate the detox process to support that pathway with things like calcium D-glucarate, if estrogen's not too low, and rosemary, dandelion root. Some of these things are very helpful, pterostilbene. And then the last phase is antifungals. And I see sometimes some practitioners will do antimicrobials and then put binders on board. But the order that works much better is to have those binders in place before bringing in those antimicrobials.
That makes sense. I listened to your podcast on glucuronidation. You could talk for an hour on that, and we won't get more into that. So you'll have to follow Dr. O'Hara to learn more, or I can maybe have her back on the show. So that was very helpful. So thank you very much for mapping out what you do for your clients. I know that you have a free gift also on your website. Do you want to tell us a little bit about Mast Cell 360 and the gift that you have for our listeners?
Sure, I would love to. So our website is at mastcell360.com, and we have a free report that I created on the most common root causes, the ones that we talked about, but you could spend an hour really on each one of those and still not scratch the surface. So that report takes people through each of the major root causes so that they can look through it and start to assess for themselves, have these all been addressed? Because and not everybody has all. Most people have 3 or 4 of those major root causes. I had all 7. But you can take a look and see, do I have this? Has it been addressed? And if it hasn't been addressed, then take that to your practitioner and say, hey, have we looked at this? Have we looked at hormone balance? And then go talk to Dr. Gray and say, consult with her and see what's going on there, or find somebody to help you with EMFs or whatever's going on. And that free report lets people step that through and gives them lots of information. And we have tons of free articles on the blog, lots of information that you really can't find hardly anywhere else. And it was such a just difficult journey that I had putting this information together and getting myself well. And it was honestly a nightmare. And so if I can take that nightmare and then take everything that I learned in this journey of healing and help people get better faster and not have to spend $150,000, $200,000, then that makes it worth having gone through.
Absolutely. Well, speaking of consultations, do you consult with patients nationally or internationally?
I do. Yeah, my practice is all remote. We're booked for 2020. But we're going to open up spots towards the end of the year. And so if people need help with mast cell activation, then they can join the email list there. We're going to announce when their spots open. And if people need to get started right now, then they can join that master class that I was talking about on the supplements. Sure. And that'll help them get through in the first couple appointments, some of the things that I do with people. And then that way, when they're ready to come in for an appointment, they're already ahead of the game.
Have that foundation laid. So what would your top longevity tip be if you had to pick one?
That's a great question. Absolutely, hands down, top one would be working on the parasympathetic nervous system, relaxation, breathing. There's lots of great tools for that. So things like the Gupta program or DNRS. There's a great headset called Brain Tap. So these are some of the things that I recommend in my practice. But to dedicate at least 20 minutes a day to something like that, it's huge. And there's so many solid studies that show that things like breathing practices, meditation, centering, shift genetic expression. And I don't think that just generally as a culture, we recognize the power of that.
Totally agreed. It's interesting. I ask so many people this question, and many of the guests' top recommendation is adapting some sort of calming practice, calm the nervous system. So we're hearing it over and over and over again. And if all these very intelligent experts are recommending it, it's certainly something we need to be incorporating. So thank you. Thank you so much for coming on the show and sharing the nightmare of your story, using what you've learned to create Mast Cell 360, which is a tremendous resource, which I am looking forward to checking out more deeply, and for taking your course. So we appreciate you. Thank you for, again, sharing your story.
Thank you so much. And thank you for getting all this amazing information out here for people.
You bet.